Yes, we are living in the 21st century. Medicine has advanced quite a lot in the past 20 or 30 years. So there are many other ways of controlling women's menstrual issues without resorting to hysterectomy. In the past, you either put up the symptoms and wait till menopause or have a hysterectomy. But these days, we have a range of therapies that we can offer to women, from medical therapy to Mirena IUD to endometrial ablation in the correct setting, not adenomyosis, but if someone has fibroid on the outside, all they have is heavy bleeding, they're close to menopause, ablation is still a good treatment choice to ease the woman's heavy menstrual bleeding without resorting to hysterectomy. And then of course, UAE for fibroids, for adenomyosis, treating this benign disease of the uterus UAE has a very high success rate to treat fibroids and adeno. Most of the hysterectomy in Australia, in fact, about 90% of hysterectomy performed in Australia, are for benign disease like fibroid, like adenomyosis. And now we do have an alternative to hysterectomy, and we should raise the awareness. We should let the GP know, and we should let the gynecologist know, and certainly we should let the public and the women know there is now an alternative to hysterectomy. So what's more important is that there are women out there, they don't want hysterectomy. They're fearful of hysterectomy. So they chose to put up the symptoms for fear of hysterectomy. If we let the woman know, you don't have to have a hysterectomy. On the other hand, you don't have to put up the symptoms. Come forward for treatment. There are much less invasive but effective treatments other than hysterectomy. So they don't have to put up the symptoms anymore, and they can improve their quality of life. They don't have to put up with heavy bleeding or severe period pain anymore for fear of hysterectomy.